Preparatory Course Medical Board. Dr. Parviz Ahmed Rishi. Dear guys, today's topic is bronchiolitis. Fever. Clinical feature. First clinical feature is fever. It is a low grade and progressive. There is rhinorrhea, dry cough, and wheeze. Wheeze is expiratory. If you forget all in bronchiolitis, don't forget expiratory, the word expiratory. Put in your brain bronchiolitis expiratory wheeze, bronchiolitis expiratory wheeze, and repeat it as long as you are preparing. Remember bronchiolitis expiratory wheeze. Hyperinflation in chest X-ray. Hyperinflation of the chest. Guys, in bronchiolitis we get hyperinflation of the chest. The triad of severity: respiratory difficulty, poor feeding, and apnea. Respiratory difficulty, poor feeding, and apnea. The severity of bronchiolitis. The triad is RPA or APR: respiratory difficulty, poor feeding, and apnea. Chest X-ray. We get three findings. What are the three findings in chest X-ray? Hyperinflation, patchy area, atelectasis, and collapse. Collapse is very rare. Hyperinflation, patchy area, atelectasis, collapse. Remember these four signs in chest X-ray. Bronchiolitis. See, we can see atelectasis, we can see hyperinflation of the lungs, we can see patchy area. Here we can't see collapse and all other things. In collapse we may need intubation. Age under 6 weeks is a risk factor. There are some risk factors in bronchiolitis. Those risk factors of for severity in bronchiolitis are age under 6 weeks. If baby has age 6 week or below, this is a risk factor. And if the baby is born premature baby with bronchiolitis, this is an indicator of severity. This is a severe disease in premature. Chronic lung disease. Baby with chronic lung disease plus bronchiolitis. This is a serious thing. This is a serious condition. Don't forget this serious condition. Bronchiolitis with chronic lung disease. Bronchiolitis with prematurity. Bronchiolitis with low oxygen. Bronchiolitis with congenital heart disease. Bronchiolitis with immunodeficiency. And you remember that the first step in the management of bronchiolitis is supportive. Guys, second step in the management of bronchiolitis is O2. If O2 is less than 90, what we do? We go further. We maintain hydration and nutrition. First thing, we maintain hydration and nutrition. And soon we do expectant treatment. Child well perfused, feeding well, O2 greater than 90, we do expectant treatment. And when do we do admission in bronchiolitis? When there is lethargy, when there is poor feeding, there is cyanosis, O2 less than 90, marked respiratory distress. Guys, admit in lethargy, poor feeding, cyanosis, O2 less than 90, marked respiratory distress. And 2% babies need mechanical ventilation. Guys, remember on your fingertips, mechanical ventilation required in 2% of infants. Those who have risk factors, those where there is lung collapse and other things like that, who have comorbidities. like immunodeficiency with collapse, congenital heart disease with collapse, low oxygen saturation. Guys, this is the end of the topic. Watch many times and like and subscribe. Thank you very much.